we talked about reparations a bit, but I sort of want to go into want to go into it a bit more. The groups, the demographic groups that have been most targeted by drug prohibition, Indigenous people and Black people, are not it's not arbitrary that those are the two groups, right? Indigenous people suffer an ongoing genocide in this country. Black people experienced slavery in this country. These are two demographic groups that still across policy areas experience disproportionate rates of poverty, medical racism, inequity in various sectors. So the need for reparations isn't just about the racism that people that those groups experienced through the policing that resulted from drug prohibition. And it's important to note that racism wasn't an sort of unexpected and unfortunate byproduct of drug prohibition. It was the explicit purpose. Many of the initial laws which sought to prohibit drugs were implemented in response to significant levels of immigration from a particular country. There are in a number of countries, I believe in Canada included, the initial laws against opium were a response to Chinese immigration, for example. So racism was the point, right? And it was built into the structure through its entirety. And so the need to provide reparations isn't just about drug prohibition itself, it's also about drug prohibition as a constitutive element of a larger structure of racism and exploitation that really does define countries in what we call the West. And so, you know, there's a city in Illinois called Evanston, and they've been using the proceeds from legal cannabis sales to provide reparations for citizens in the city who have been, I think it was maybe 1 or 2 generations prior, had also lived there, and they were descendants of enslaved Africans. And they weren't, you know, there wasn't really a sort of need to say this is like we're using this for specifically only people who have been affected by drug prohibition. I think one thing that's been one thing that's been pointed to as a measure of reparations in a lot of places, priority access to the legal market. I find it extremely troubling that people would advance the argument that simply because you were arrested and bear a criminal record for having possessed a drug at some point prior in your life, your primary economic opportunity for the rest of your life should be in the legal market that has now been created for that drug. It's still not providing people self-determination, which is ultimately what criminalization robs people of. Your life course outcomes are restricted in more ways than we have time to discuss in this program. And so if the government spoke about this as a historical injustice, there must be serious reparations, and there's been effectively nothing. I think it is absolutely deplorable. And if this review is to take seriously about the arguments made in favor of legalization that talked about justice, again, arguments that saying that if a substance is going to be used, then it's best to have it produced safely in a safe environment to ensure that the product, when it's used, isn't going to have adverse consequences. That equally applies to every other drug. You know, these are the people who talk about evidence-based policy, but they won't look at the sort of evidence implicated in their own arguments. It's I think that the fact that the Liberal government was able to sort of get a political win out of this without having to seriously engage with a century of history of racism, of violence, and deprivation is absolutely shameful.